Welcome to Dr. Shelley's Sex for Health educational series. My name is Dr. Shelley, and the research I will share with you is what I discovered when doing my dissertation for my doctoral studies, and also as the subject of my book, The Anti-Aging and Health Benefits of Sex. This research was inspired by the many individuals and couples I have worked with over the years who have complained about losing their sexual desire and were looking for ways to enhance their relationships and increase their libido. My intention was to appeal to their intellects and show them the scientific benefits of increased sexual activity so they mentally understood the benefits of increased sex, inspiring them to have more and thus help their health and their relationships. The first part of this series focuses on the physical benefits of sex. Sex can help relieve pelvic pain, reduce stress, elevate mood, lessen the risk of breast cancer and prostate cancer, can help relieve headaches, and also help to create that healthy glow. Many of these studies are referred to in my book, The Anti-Aging and Health Benefits of Sex. And one such study by Dabrick looked at the occurrence of chronic pelvic pain syndrome and was found to be quite common amongst a United Nations peacekeeping force in Haiti. It was characterized by urinary symptoms and pelvic pain, but without signs of inflammation or infection. Dabrick reported that this disorder was quite common and was associated with prolonged separation from their spouses or lack of intercourse. Most failed to respond to multiple courses of antibiotics, and masturbation had no impact, but the majority reported that resumption of normal intercourse helped to relieve the symptoms. Allison, in her book Women's Sexualities, reported masturbation may help reduce menstrual cramps. And a study by Couch and Bears showed relief from headaches and migraines with sexual intercourse. 70% of the 82 women in their study reported having had sex during at least one migraine attack, and approximately half experienced at least some relief from the headache following sex, and almost 20% reported a complete relief from the headache. You ever noticed a sexy girl or guy walking down the street? They walk that walk and turn heads. Be aware of how you strut your stuff and be conscious of the fluidity of your movements. Sexual attractiveness comes from within, and if you're wanting to attract that special someone to you, walk that walk. And if you're already in a relationship, walking that sexy walk can help keep the relationship young by making your partner proud to be seen out with you. A study by Nicholas examined the association of general everyday body movement with history of vaginal orgasm by asking healthy young Belgian women to be videotaped walking on the street. Their vaginal orgasmic status was judged by trained sexologists, blind to their history. The gait of the vaginally orgasmic woman was characterized by being physiologically normal and manifested fluidity, energy, sensuality, and freedom. So having more sex can help you have a more flowing, sexy walk. Try it. See whether it works for you. Another good suggestion to make to your partner is that research has shown increased sexual activity can help keep you healthy down there. So let's make sure you get plenty. Tell them, I want to keep you healthy and happy. Levin concluded that vaginal intercourse helps maintain vaginal and pelvic function, and the presence of semen in the vagina after ejaculation helps to maintain vaginal oxygenation and blood flow. Using condoms, it was noted, deprives women of many of the health benefits, including those blood flow and oxygenation benefits. With breast cancer at an all-time high, I would suggest trying everything possible to reduce your risk. Increase your sexual activity and also your cuddle quota. Both can help reduce the risk of breast cancer. Just tell your partner the research supports that. There are several studies showing the benefits of sex in helping to reduce breast cancer. Frau Meaning found that nuns have a very high rate of breast cancer. A 1989 study by Lay found increased frequency of sexual activity related to a reduced incidence of breast cancer. Women with infrequent or no intercourse had 3 times the risk of breast cancer. Murrell suggested increased oxytocin produced during sex could be preventative in the development of breast cancer. And Rossing found women whose men used condoms or withdrawal and women not engaging in intercourse at all had a breast cancer rate 5 times higher. a good excuse for me to go and have more sex, that's for sure. And with men, did you know that sex is good for the heart? Research has shown that sex can keep both women's and men's hearts healthy. So another good conversation starter could be, maybe we should increase our sexual activity so that we can prevent heart disease. Abramov did a study of 100 Israeli women aged between 40 and 60 who had heart attacks and showed a statistically significant correlation between lack of sexual interest and heart attack. 65% of those with coronary history showed a complete lack of sexual interest. Bolam, in 2004, compared the exercise value of men engaged in masturbation by a partner, and 2 intercourse positions, man on top and woman on top. Their results showed that intercourse produced far greater duration of heart rate elevation and substantially greater oxygen uptake at orgasm than the other activities. So a note from Dr. Shelley, increase the heart rate, have more sex. There has also been a lot of research linking increased sexual activity to reduction in the rate of prostate cancer. So, another conversation starter, suggest to your partner that if they really want to help prevent prostate cancer, that you really should be having sex at least 3 times a week. Giles found men who had an average of 4 or more ejaculations per week during their 20s, 30s, and 40s had a significantly lower risk of developing prostate cancer. Leitzman found at least 21 ejaculations per month was related to a decreased risk of prostate cancer, and Mandel and Schumann found that men who had intercourse more than 3,000 times in their lives had half the risk of prostate cancer than those that did not. In my book, The Anti-Aging and Health Benefits of Sex, I also outline the nutritional value of semen. I know guys will love sharing these studies about the nutritional content, and I actually had a vegetarian client who loved ingesting semen. She perceived it as a great source of protein. One typical ejaculation can contain 150 milligrams of protein, 11 milligrams of carbohydrates, 6 milligrams of fat, 3 milligrams of cholesterol, 7% of the US recommended daily rate of potassium, and 3% of copper and zinc. Another client shared that he increased his girlfriend's semen intake when she was premenstrual, as the zinc component really helped balance her brain chemistry. And there's another study by Disayaki that showed that possibly zinc has even higher levels per semen intake. One ejaculation apparently also contains the same amount of vitamin C as an orange, plus it includes calcium, magnesium, potassium, selenium, salt, B12, and more. For a full list of the nutritional components of semen, please check out my book, Anti-Aging and Health Benefits of Sex. Now, many people have concerns surrounding the risk of HIV and AIDS that comes with unprotected sexual intercourse or venturing outside of their relationship, but there are several studies showing the reality of HIV and how low the risk is, especially for heterosexual couples. Stuart Brody, who wrote the book Sex at Risk, said it is very rare for heterosexuals to get AIDS. Apparently the risk groups are intravenous drug users and people who participate in anal sex. The largest study of heterosexual transmission of HIV in the US confirms that it is difficult for HIV to be transmitted via vaginal sex. We estimate that infectivity from male to female transmission is low, approximately 0.0009%, said Padian, and that infectivity from female to male transmission is even lower. One study of Zambian women by St. Lawrence found that invasive medical exposures were associated with greatly increased HIV incidence, but measures of sexual activity, including intercourse as well as lack of condom use, were not associated with increased HIV incidence or prevalence. And there are many other studies that I refer to in my book that further support this research. In summary, it seems that recent research shows that heterosexual sex between healthy adults without condoms is not as dangerous as promoted in the media. Unless you know your partner's complete sexual history and trust that they have never had any other risky sexual activity or drug use, it is always better to be safe than sorry. One partner may claim to have had no history with drugs, anal sex, or bisexual activity, but then their previous partners may have. So until you are both tested, use condoms. The conclusion would have to be undeniably that sex is good for you, good for your health, helps keep you young and vibrant, and keeps your relationships young and is a necessary part of human existence. Sex, I feel, could be considered the ultimate health supplement. For more information, please go to drshelleys.com and sign up for my free newsletter. Also on my website, you can get a copy of the book that I have based this research on, called The Anti-Aging and Health Benefits of Sex. In that book, there are 7 pages of references, including the studies that I've mentioned in this presentation. My other book, Soul Sex, is a sexual adventure about a New Zealand girl travelling around the world in search of the ultimate sexual experience. It's a spiritual sexual awakening, and both books are available on my website, drshelleys.com. Also on my website, you can click on a tab of upcoming workshops. My next workshop is a Sex for Health Weekend Intensive in New Zealand, October 17th to the 19th, which is Friday evening, all day Saturday and Sunday. If you're interested, please send me an email to info@drshelleys.com. Thanks again for tuning into this educational series, and stay tuned for the next part on emotional health benefits of sex.